I'm going to start out today focusing on a little bit of history and the definition of survivorship, and then I'll get into the goals of survivorship and what we're trying to do at Dana-Farber and around the country and the world to improve the lot of folks who've been through cancer so that they can move through and beyond what often is a life-changing experience and live the fullest and the wholest that they can. But I want to start with a definition. Cancer survivorship has been defined by the National Cancer Institute in the US and the National Coalition of Cancer Survivorship as a person, or a cancer survivor is a person who's been diagnosed with cancer and is alive. And it's not only the person that's included in this definition, but it's all of their loved ones. So if we use that definition, and here's some living proof folks from the Dana-Farber, and I'm sure you'll recognize a few of them, and I'm sure, especially in this room, everybody has some relationship to cancer. But even in the wider world, when 1 in 3 Americans will get cancer in their lifetime, that essentially means that everybody's a cancer survivor, which is great for fundraising and for things when you're thinking about certain aspects of cancer survivorship, but obviously it's quite impractical because the whole Dana-Farber, one could argue, is in the cancer survivorship business, right? We're all in the mission of getting more survivors, and that's what we focused on a lot with today's talk. But what, practically speaking, the field of cancer survivorship focuses on, and this is an emerging field, and people often ask me, like, what is it that you do? And it's only been really emerging in the last 10 years in adult oncology. Practically speaking, it's about folks who've been through cancer and are in that watch and wait period, or even beyond that. Folks who are either stable on chronic medication, or people who've been treated for cure, hopefully, but are living with the aftermath of cancer. And that's what that part of the cancer care trajectory is, what survivorship is, practically speaking, and what we focus on. And I want to take us back a little bit, about 20 years, when people across the country noted what was going on in pediatric oncology. And as you heard earlier today, and we all know, Sidney Farber was a maverick and helped to really set the stage for the future of the idea of cure with cancer. And that started in pediatrics, and it started with childhood leukemia. And about 20 years ago, led by Lisa Diller, who's here today, the Dana-Farber had one of the first clinics that was started focused on the care of childhood cancer survivors, the Perini Childhood Cancer Survivor Center, obviously supported by generous work of the Perinis. And they started that with the recognition that when you treat a child, especially a child who's going through growth and development, and you get to that wonderful word cure, which, again, I agree with Kim, our work is not done and there's still challenges, you get that person and their family to cure, but it's not the same. Their life has changed. They now may have growth and development problems. They may have endocrine problems. Psychologically, a child who's been through cancer is very different than a child who has not been through cancer. And then as they grow into adulthood, there are myriad, both medical and psychological and social issues that may come up. So once again, we follow the pediatricians into adult survivorship 10 years later, about 10 years ago. The group at the Dana-Farber recognized that we have this problem in adults now, which is a wonderful problem to have as we grow our survivorship population. And it's estimated in the US that there are about 12 million survivors, obviously millions more worldwide, and there are going to be about 22 million survivors in the US by the year 2022. We know that this is a growing population, and it's a good problem to have. We've got all of these people who've been through cancer, who are at risk for recurrence, and also, importantly, at risk for the medical and emotional things that a cancer diagnosis and treatment can bring. And so that is what survivorship focuses on. And with the generous support of private donors and the Livestrong Foundation, the Livestrong Center of Excellence here at Dana-Farber, the Adult Survivorship Program was started about 10 years ago, and that's what I lead now over the last few years. Now, what do we focus on here? We focus on, first and foremost, what we're doing throughout Dana-Farber, which is making more survivors. And so one of the most important goals of follow-up in survivorship care is to look for disease recurrence, because especially in adult oncology with solid tumors, that's usually the biggest risk people face over the first few years after diagnosis. That has a lot of implications. So it's not just looking at scans and whether we do them or not, it's also understanding their genetics. Are they at higher risk for a new cancer by virtue of the fact that they had a prior cancer? So we do a lot of collaborations in survivorship with groups like the genetics group that Judy Garber leads. We also focus on the management, including screening, treatment, and prevention of long-term and late effects. Somebody asked, what are the side effects of these drugs? As Steve Hody and his immunotherapy group get to more and more people that are long-term survivors, there are actually going to be a whole lot of job security for people like me in that, because there are going to be aftermath issues. There are going to be side effects we didn't even know about as we grow these therapies and grow these populations. And we need to be prepared to handle that and help people live well and get through that, and then start to screen and monitor, and then ultimately, like they've been doing in pediatrics for years, start to say, okay, who doesn't need what? And as we manage that and recognize that, and Dana-Farber is, I think, uniquely prepared to do that because we're so collaborative, we're going to be more proactive about having fewer people have those long-term problems. So long-term late effects, and again, those are both medical and emotional and societal. The third thing that we focus on is health behaviors. So we know, especially in the United States, we've got an obesity epidemic. Obviously, people still smoke, although that's improving, and we've got lots of other issues that can can cause cancer. So once a person's had diagnosis of cancer, how can we help them to manage the things that may have contributed to their getting cancer in the first place? And that's a huge problem. It's a problem in general medical care, and of course, in survivors, we know that we have an opportunity, though, because these are people who've just been scared, and the euphemistic way of terming that is it's a teachable moment. They may be in a point in their lives where they're actually ready to make a change because they were scared, ready to quit smoking, ready to stop drinking as much, ready to get on that exercise program or change their diet. We need to be there to help them to do that. It's one thing to say to do it. It's a whole nother thing to actually get someone to change their behavior and their lifestyle. And so, along with my colleague Jennifer Ligabell, who's now running the ZACM, we're working on healthy lifestyles after cancer to help people to get there. Don't just tell them to do it, but let's develop programs in conjunction with community programs to get them there so that their afterlife, in terms of after cancer life, can be better and healthier. And then finally, a huge challenge, and this is the business model for survivorship. A bunch of us went to the Harvard Business School a few years ago, led by Ed, and we found out that this is how Benihana managed it. You not only have to actually get people in the door, but you need to manage the exit. And we need to help our survivors to be cared for and get the right care at the right time, but not redundant care, and get what they need, but not what they don't need. And we've seen examples throughout our literature that suggest that survivorship care historically has been catch as catch can, which is the equivalent of poor quality. And so one of the huge initiatives we're working on is to make survivorship care more coordinated, get people back to their primary care for the right things, back into their oncologists, to dedicated survivorship providers for the things they need, and make sure that they're getting what they need from the right people at the right time. And I'll end with survivorship care is not a one-size-fits-all approach. Just like treating the cancer when a person comes in, we look at all of the facts about the person, we look at all of the facts about the disease. In survivorship care, we need to tailor it as well. Not everybody needs everything, but we need to focus on the person, who they are, what they've been through, and how we can help them to move forward to live the best and fullest life. And I'm not a ballerina, but I was a gymnast for a short period of time. And I was taught you have to stick the landing. So I'll end with a quote. And that quote is from a physician named Fitzhugh Mullen, who published in the New England Journal now about 30 years ago, a beautiful essay, if anybody's interested, called The Seasons of Survival. And in that, he said, the great challenge of cancer is not only arresting the disease quickly, but mitigating the medical and social hazards that arise. Thank you.